everyone, and welcome. I'm Marc Steiner, and welcome to the Marc Steiner Show right here on the Real News Network. Today, we're about to have a conversation with Ben Jealous, who's running to become the next governor of the state of Maryland. Has to get through the Democratic primary before. Of course, Ben Jealous was president of the NAACP, which is why many of you know who he is. He also has deep, deep Baltimore roots and joins us here in our studios at the Real News Network today. And Ben, welcome. Good to see you.
Thank you, Marc.
Welcome.
Good to be here.
So there's a lot to talk about in the time we have, so let's just jump into it. One of the things that you talked about was a single-payer system, or healthcare for all system in the state of Maryland. So the question is, I think, on a lot of people's minds, and the Republicans have already really attacked that, and I've seen it all through the web about the taxes it's going to cost us for you to do that. But when you look around the country, Vermont couldn't pull it off, and they had a smaller state, a progressive state, they had to back off, right? California decided not to do it.
For now.
And it seems that a lot of people would argue that even though it may be the best system for health care to cover for our citizens, you can't do it statewide. You can only do it nationally. So, I mean, how do you plan? I mean, one of the arguments in Vermont was that it was almost as much as the entire budget to make a single payer work in the state of Vermont. So how do you make that work in the state of Maryland?
You know, I think it's worth pointing out, you talked about California, there's a movement building there. And as we've seen with various pieces of legislation over the years, it takes more than one cycle. So now Gavin Newsom is running for governor of California. He's very clear that he intends to make California the first state to pass state-based Medicare for all. If California doesn't get there first, if New York doesn't get there first, we will here. You can look at the Rand Corporation's study on Oregon. And what they say there about Oregon is also true here. Oregon's 2/3 the size of Maryland, but 5 times larger than Vermont, at least, if not 6. It says that the most expensive option is the status quo. The most expensive option in America for healthcare is the status quo. Our healthcare system, we put more money in than any other Western nation, and yet our people get less care out of it. In Maryland, we have 350,000 people who do not have healthcare. It's the #1 cause of bankruptcy in our state. It's top 5 cause of untimely death. I spent 6 months of my life trying to move a factory from Canada to South Baltimore onto a block on East Reedbird Street, 3/4 of which is a public housing project, 1/4 of which is a brownfield. We would have put the factory in that brownfield. Day 1 would have brought 30 good-paying jobs with healthcare, low-skilled jobs that the residents of the housing project could have been trained in. Day 1,000, we estimated 300. The deal fell apart, not because you have to pay for healthcare here too, but because our healthcare costs under Governor Hogan have surged so much. They go up 10% or more a year. So as a small business person, my question is, how do I get a better deal? Because I'm committed. At Cape Port Capital, we're committed to providing healthcare to all of our employees. It doesn't matter to us if it's our healthcare costs going up or our taxes going up. The bottom line is that our bottom line is getting squeezed. And the only way that we can take on the pharmaceutical companies, the only way that we can cut the overhead, the only way that we can get a better deal for the people of Maryland, all of them, is to move to single payer. Canada started with 1 province. We can start with 1 state. The scale is big enough. We just have to have the courage to pursue a whole solution to a whole problem. Your mom, my grandma, we're both social workers here in the city. I'm sure your mom would say what my grandma says. She's 101 now. She says, baby, don't try to half solve a problem because you still got a problem. You got to bring a whole solution to a whole problem. And I'm proud to be the only person in this race with a plan. It's on my website. It's called MD Care, to bring single payer to our state. And the funny thing, I smiled earlier when you were talking about the Republicans. What the Republicans are afraid of is that I've already had people who voted for Trump approach our campaign, switch back to be Democrats in order to support our campaign over single payer because they're small business people on the Eastern Shore whose businesses are being squeezed by Hogan allowing healthcare costs to go up double digits every year. This is how we get it under control.
So let me ask a question though. Let me push that a little further with this. So as also a small business person, we have a small production company and we cover healthcare for our employees. Costs a lot of money.
And it keeps going up.
It keeps going up.
And you get anxious before the open enrollment period because you're like, oy vey, what's about to happen to me again?
And so it's not good. And the deductible stinks. I mean, it's very high. But the question still remains, I mean, how do we pay for it? Saskatchewan in Canada, I mean, it's a huge province. It was isolated, which is one of the reasons they could do it and did it.
And huge as far as size, not so much people.
Right, and very isolated in terms of the rest of the country in many ways. So, but the question is, how do you translate that to Maryland? How do you pay for it? I mean, when you have behemoths like Johns Hopkins, when you've got what just happened at MedStar, closing their pediatric center because of the corporatization of medicine.
Yeah.
That's a lot to control inside of that as well. You've got the insurance industry in Maryland, which has a lot of employees. It's huge in the state of Maryland.
Yeah.
So how do you, I mean, that's a huge ship to turn around for single payer. I mean, what is the plan to make single payer work in the state, other than the fact that it would do us all better? How do you get there?
Well, one thing that we've said, my plan on my website, very much based on the plan that Kamala Harris and Cory Booker and Bernie Sanders are all supporting in the U.S. Senate. Point out that they've also all endorsed my campaign as the only one to really unify Democrats to beat Hogan in our state. And it starts off with a period, and we envision this could take as long as 2 years, where you pull all the big players together to work it out. Like we've got, one of the things I excel in is pulling together big coalitions. I was trained young to help people identify their self-interest and then kind of pull them together and hold them together. I've done it throughout my career. So I was so successful as the youngest national president of the NAACP. And so we'll pull people together, major employers, unions, doctors, nurses, consumer groups, et cetera, to small business people to figure out a plan that works better for all of us. What we know is right now, how is healthcare paid for? It's paid for by employers, it's paid for by people. You pay your premiums, there's the employer premium, and those are basically the options on the table. I'd prefer to find a way for this to be done strictly through employer premiums. I think you need to have both options on the table. We know other states, when they looked at it, California, for example, said it would cost 10% more to cover everybody in their entire state. Well, that 10% number is important because our costs go up by more than 10% every year, and we're still not covering 350,000 of us. And it's the number one cause of bankruptcy in the state. And so what you know is you can stretch the dollars further. How do you do that? One, there's a loophole in federal law that allows states to renegotiate with pharmaceutical companies. Those companies are, if they're not charging us twice as much as they're charging people in Canada and in Europe, they're charging us 5 times as much. We have to renegotiate with them. We know that the overhead for Medicare is 3%, but I have Blue Cross Blue Shield, it's 19%, and that's about what it is for all the other ones. Some doctors say that by the way, that they think it's even higher, but that they hide the costs and other things. Well, let's call it 18-19%. Well, for Europe, like I said, Blue Cross Blue Shield, 18-19%. Medicare, 3%. England, France, Canada, 8-9%. We can cut overhead and stretch the dollars further. And then as Maryland, we've actually been running an experiment since the 1970s, which we accelerated 4 or 5 years ago at the end of Martin O'Malley's term, called All Payer, where we only allow each hospital to charge one rate for each procedure, no matter who the insurer is or which, and it's already saved us more than $580 million, and it's slated to save us $1 billion more over the next 5 years. That's the biggest step any state has taken so far towards single payer. It's saving us a ton of money. It confirms that as we continue down that road, we can expect to save money, and that's what we need to be doing when our small businesses are being choked and when people across our state are being forced into bankruptcy by our healthcare system.
So let me move on to a different subject here. Let's talk about your idea about cutting down prison populations by 30%. I think that's the number you used, right? Yeah. Now, I've been covering this for a long time.
Sure.
And I've been pushing every candidate I've ever interviewed on this issue.
Yes. And I've got to be the first one who actually has a plan to end mass incarceration.
So let's talk about what that means. I mean, you've got you've got you may have a very recalcitrant General Assembly in many ways. I mean, look at the bill they just passed, which is pushing mass incarceration even more. You've got, again, this is a huge ship to turn around. You've got a corrections officers union. You've got people employed by the penal system. You've got you'd have to reform that and reform probation and parole in order to make this happen.
Yep.
You have to work with the judiciary to kind of figure out what do you do instead of incarcerating people. So I mean, so what is the plan? I mean, it sounds great, but again, I think our concern is how do you get there?
Sure. So one of the reasons why I'm confident we can get this done, there's a few reasons. One is we've already passed the Justice Reinvestment Act in Maryland, which by some accounts is working better than projected. Maryland has begun to shrink its prison system over the last couple of years, and there are different theories, but one of them is that the Justice Reinvestment Act is working better than projected. I'm confident because as president of the NAACP, I worked with governors and with bipartisan leaders in other states as conservative as Georgia and Texas, to push through wholesale criminal justice reform that has shrunk their prisons almost 30%. in the last 3 years. So I know it can be done. And in order to empower us, as we were preparing to work with those states, I released a national criminal justice reform strategy for the NAACP. And Mark, when I did it, I mean, you would have loved this. I had every civil rights leader that you would expect to be there. I also had Grover Norquist, Newt Gingrich's spokesperson, because Newt was on a plane that day, with a 2-page letter of introduction for our report, of endorsement for our report, which proved very valuable in Georgia and Texas, because those Republican folks weren't going to read my report, but they'd read Newt's letter. And the head of the largest corrections officers union in the country. And this was the California Corrections Peace Officers Association. Their folks have been working 20 hours plus mandatory overtime every week for years, which some people think, oh wow, they're excited to get that. Not really. It's destroying their families. They want time for basketball practice and baseball practice, and to be home in time for dinner, and they weren't getting that because they were at triple occupancy in their prison system. And so, what I know is that there is a common sense, bipartisan consensus to be forged. I've helped get it done in other states. We can do it here in our state. As the person who put together the winning campaign in Maryland to abolish the death penalty, and who co-chaired the successful campaign to pass the DREAM Act, I know how to get big things done, and quite frankly, not just to deal with Republicans who may be distrustful of a progressive or a Democrat, but also, quite frankly, how to deal with Democrats who might be, inclined to be a bit backwards on these issues.
Maybe clear, in the state legislature, you have leaders like Senate President Mike Miller and others, who's a Democrat.
Yep.
Who's been in power for a long time and been in office for a long time as president of the Senate, is not going anywhere.
Yeah. I mean, he goes to work in a building that's named for him.
Exactly. So, and getting that passed.
Well, let me tell you how we do it, because this is what I did. So here's the thing, right? Martin O'Malley tries to abolish the death penalty, could not get a floor vote. Ben Jealous comes back a few years later as president of the NAACP. I say to Martin, I say to the governor, I appreciate if you'd support me. He said, sure, if you can get a floor vote, but Mike Miller wouldn't give me one, so why would he give you one? What's the difference between me and our previous esteemed governor? I'm an organizer. And after a couple of months of me organizing... I
thought you were going to tell me you liked his bourbon. Right?
He's more of a Guinness guy, I'm more of a bourbon guy. But after a couple of months of me organizing Mike Miller's district, I ran into him at a Christmas party. And he said, Ben, what will it take to get your people to stop? It was the holiday time, we were phone banking his office, no one could phone in a holiday greeting, pick up the phone, somebody saying to abolish the death penalty, give Ben his floor vote. I said, oh, Mike, you know what it would take. You just give me my floor vote. He said, Merry Christmas, Ben, you've got your floor vote. Well, that's how we got the vote to abolish the death penalty in Maryland. I'm an organizer, first and foremost. And as governor, I'll be an organizer too. I tell folks, look, any politician who stands here and tells you that they're going to change the world by leading politicians doesn't understand how to change the world. It's not the politicians who give the people courage. It's the people who give politicians courage. Look no further than Parkland. Forget about the 7th and 8th graders leading walkouts. We've had 7 and 8-year-olds leading classroom walkouts. And it's given politicians more spine, because they can feel the energy coming from the people demanding change. And so my campaign is a movement. We build a movement across this state. You see it in that we've got the lion's share of endorsements. You see it in that we have more individual donors than everybody else combined, and a lower average contribution than even the guy running on the public option. And that's how I'll conduct myself as governor too. I will first and foremost lead the people of this state. You belong to them as governor. And I will lead them in getting the big things done that we need done for all of our families.
So, a couple of really glaring things to me in all this. One is that it's good to cut down on our prison population. I think you got conservatives to liberals, progressives, people across the spectrum saying it has to be done.
Poor addicts need what rich addicts need. They need rehab. They don't need prison.
That's my next question. So my next question is, again,
how do we do it? How do we do it? I'm sorry.
And how do you pay for a rehab? How do you transform things so if somebody does get busted? There used to be, when there was federal money in the state, which doesn't exist anymore, there used to be money to have pretrial interventions so you can actually work with people to help get their lives in control and go on and lead productive lives, and it actually worked, but that's gone. And then the underlying cause of everything, which is the massive poverty that people face in places like Baltimore City and other parts of our state. So I mean, so without kind of an overarching look.
Yeah, well, then there's a whole lot there, but everything that we're doing in this campaign is designed to help alleviate poverty in Maryland. As Democrats, the people have to trust that we are committed to ending poverty. And for a quarter century or more, we've strayed too far from the roots of MLK and RFK and Shirley Chisholm and even a young Barbara Mikulski. From the roots of our party really being the party that is committed, yes, to civil rights and expanding opportunity, but also to ending poverty. And so we've talked about that with healthcare. Mass incarceration, in neighborhoods like the neighborhood where my mom spent most of her childhood, Upton, Baltimore, we have $1 million blocks. We're spending $1 million or more to incarcerate adults from that block. Most of those folks, low-level offenders, many of them addicted. And so the plan I put on the table would change policing. We would go away from failed broken windows theory, which says basically bust people for little small things and you'll keep your town safer, back to the old first things first policing, which says, we're going to focus first on homicides and rapes and home evasions and other serious crimes. Maryland, last time I checked, we had 3,700 unopened rape kits. That's an outrage. So under my administration, you would actually see more funding for expanding homicide units, expanding special victims units. You'll also see enough funding to finally fully fund our Safe Streets program. We've expanded it some, but it needs to be much, much bigger to change how we do victim services so that people in the community are getting victim services help if they've been the victim of a crime, not, even if they haven't reported it yet. So important. Only 1 out of 5 crimes is reported, but yet 5 out of 5 crime victims is traumatized, and we got to make sure that they get the help that they need. And so when you do that, what you'll find is that we'll be sending fewer people to prison, but more violent people to prison, and that's exactly what you want. You want more killers and more rapists off the street, and yet you don't want your addicts filling up prisons. They should be filling up rehab. When you look at sentencing, first thing you have to understand is that it's usually done in an ad hoc way, and so you have new laws that compound old laws in ways that were unanticipated. So what we did in Georgia, working with the governor of Georgia and the then minority leader, now candidate for Governor Stacey Abrams, we in the NAACP and the Tea Party also, we were all working together, was to streamline that system so you took out the waste. And you kept violent people in for as long as they needed to be in, but again, you focused on rehabilitating the folks who are going to be coming out, making sure that they learn how to read. If I can make it easier for you to get a job when you get out, then I just made it less likely that you'll come back. And over time, we're going to shrink the system that way too.
But where does the money come from for all this?
What I'm saying
how
is
we
that
pay for this?
We have seen the systems in the states that we worked with when I was president of the NAACP shrink about 30%, close to 30% in 3 years. That saves you money. As somebody who's been a CEO or a partner in small business most of the years since I was 26 years old, what I reject is that doing better always costs more money. There's a lot of times when doing better just means managing what you have better. I'll give you an example. Our kids were freezing in the schools this January, made like international news. Our Lieutenant Governor, Boyd Rutherford, tweets out, "If those were my kids, I'd be very concerned," or something like that. I tweet back at him, "Hey buddy, you're the Lieutenant Governor, they're all your kids. So I guess I'll see you down here at North Avenue very concerned." He says, "What time?" I said, 3 o'clock. It was about 3.5 hours. It was time for him to get there. He didn't show up, I did. Bottom line was, I called Sonia Stantelides, superintendent of the schools, and I said, CEO of the schools, and I said, "Sonia, do you have any boilers that are more than 30 years old?" She said, "All of them are more than 30 years old." I said, "That's really good news." She said, "Why is that good news?" I said, "Because that means we don't have to ask the state for new money to replace them." See, every boiler that's more than 30 years old is so environmentally inefficient and uses up so much power. And the new state-of-the-art heating systems, the best in the world, made in Japan, Norway, or the US, are so inexpensive to both buy and operate that if you can just get somebody to finance the purchase of the new heating systems, you can pay them off. And they say in 2 years, so definitely in 4 years, but they'll last you like 20 years. And so you can actually look forward to, one, spending less money on your power bill and more money on school, but also to higher student attendance. And she's like, "Because the kids won't be freezing?" And I said, "No." I said, "That too, Sonia, but because all those boilers are producing smog. And the smog recirculates through the building. And that triggers asthma attacks. And that triggers absenteeism of both teachers and students." That's what it's like to have the heart of a civil rights leader and the mind of a business person who says, I just reject the notion that just because we have limited funds, we have to do things badly. We should use that as inspiration to find a better way. And so it is with our criminal justice system. We know we can cut it, we can save money, and then we can reprioritize that money for rehab, we can reprioritize that money for public higher education. We also, when we look at our healthcare system, the number one question we should be asking politicians is how can we afford the status quo? Because under the current regime, Hogan has healthcare prices going up more than 10% every year. Who can afford that? I know I can as a small business person. I know I talk to small business people across the state. They can afford it. And then I have to sit in churches with individuals who are homeless because they got hit by a car when they didn't have health insurance and it wiped them out. That shouldn't be able to happen in the world's wealthiest democracy. It's fundamentally about spending our money better.
So you mentioned Governor Hogan.
Yeah.
In all the years I've watched politics in the state of Maryland, or participated in it, or covered it, or whatever, right, all those things. I have never seen a sitting governor that seems to have created so much satisfaction, despite the things you're laying out here, among the people of the state of Maryland. You see 47% approval rating, or they don't align him with Trump, or all the other things they say. And he's also turned out to be, I think, a really good politician.
Yes. He's slick.
Very, free community college tuition, and sitting there with Mike Miller and Speaker Bush. So how does any Democrat take that on at this point? Because clearly people have felt that most previous Democratic administrations in the state of Maryland, at least in living memory, have been detached from the people, have been detached from the state, which is one of the reasons Hogan won. We can talk about...
You speak to the people about solving the real problems that are facing them, solving those whole problems, but solving our healthcare crisis, solving our student debt crisis, solving our mass incarceration crisis. We don't just have the most incarcerated black people and brown people on the planet, we also have the most incarcerated white people on the planet too. And what they all have in common is they tend to come from zip codes that are low-income zip codes. So you get in there and you talk about that pain, ending the opioid crisis, ending police killings of unarmed civilians. And that's what we've been doing. And that's why I've succeeded in getting the lion's share of endorsements in this race and building a bigger army of supporters than anybody else. Larry Hogan is playing by an old politician's playbook. The widest lane to re-election is to do nothing. You talk about community colleges. All he did was get straitjacketed by a Democratic supermajority into signing a bill to put $15 million into our community colleges. It will not provide free community college tuition for everybody. It'll make it more affordable for some people. What I've put a plan on the table to do is to, frankly, tax the 1% and 1% more. And then pay for community college tuition again for everybody. Why? Because we used to pay for it. We used to pay for it for everybody. Our colleges, if you go back a day before mass incarceration, were tuition free. Somebody said, even the rich kids? I said, yeah, even the rich kids, because their parents will be paying for it. We're taxing the 1% more. But you and I both know that it's time for our society to go to making 13th and 14th grade free. Just like a long time ago, we made 9th, 10th, and 11th, 12th grade free after ending years of only having public education through the 8th grade. Because we needed to for our economy. And that's what we need right now. And the people of Maryland are willing to accept that sometimes we've got to invest a bit more in order to get a whole lot stronger. I look forward to taking on Larry Hogan. Larry Hogan, we've been told for a year, we're the only campaign he fears. Why? Because he got in office through low voter turnout. It was the lowest Democratic turnout on record in Maryland and the lowest nationally since 1942. Well, my running mate, Susie Turnbull, a cycle earlier, when she was chair of the party, turned out 125,000 more voters. 2010 that would show up in 2014. And when I was president of the NAACP, Van Jones on CNN called me the unsung hero of Obama's re-election because I turned out 1.2 million unlikely voters. We turn out the likely voters, we will beat Hogan. We turn out unlikely voters, we will wallop him. I'm in this to wallop him because we need people coming into the state capitol with a mandate to solve the big problems that are facing the people of Maryland. Healthcare, education. That's why I've been endorsed by the teachers. That's why I've been endorsed by the nurses. They know I actually have the courage and the capability to pull folks together to solve these problems.
Well, Ben Jealous, it's been a pleasure to see you once again and have you back here on the program.
It's good to see you. It's good to see you.
Good to have you. Good luck on the campaign trail. We'll see you down the campaign trail and see how this all rolls out.
All right. Thank you, Mark.
We've been here with Ben Jealous, who is running to become the Democratic nominee for governor of the state of Maryland. I'm Marc Steiner for The Marc Steiner Show on the Real News Network. We'll catch you all next week.